Hello, today we're going to talk to you about measles. Hopefully you'll learn something you didn't know before. I'm Kayla, and I'm going to talk to you about exactly what it is and incidents, when it occurs. So measles is also known as rubeola. I don't know if you've heard of that before, and it's a highly contagious viral disease. It's an acute infection caused by morbillivirus from a paramoxavirus group. Defining characteristics are that it lasts more than 3 days. It has a fever above 40 degrees Celsius, which is about 104 degrees Fahrenheit, so pretty high fever. And it has the 3 C's: cough, coryza, and conjunctivitis. The first vaccine was given in 1963 in the United States, and it's now combined with the mumps and rubella, so the MMR vaccine, we all had it twice, the MMR. Sadly, before the vaccine, measles was considered an inevitable part of childhood, and about 95 to 98% of children had measles by the time they were 18. Kind of like how you hear about the chicken pox now. We all had it once, most of us. An at-risk population is young children, especially in developing countries because they don't have the immunizations there. Children that are malnourished, those with HIV, leukemia, kind of with corticosteroids that have immunosuppression, and pregnant women are also at a higher risk. Boys have a higher incidence than girls. The number of reported cases has been decreasing each year, which is good. And in 2000, there was 853,480 cases and 542,000 deaths, whereas in 2011, there was only 354,922 cases and only 158,000 deaths. So a lot less cases and a lot less deaths happening from each case. And the Americas have the lowest incidence every year.
Okay, and I'm Kinsey. I'm going to talk about transmission today. There are no animal reservoirs for the transmission of measles, but it is transmitted through droplets, so respiratory secretions, which is why it's really good to cough into your arm for one, and also use hand sanitizer, like when you shake someone's hand or just on a regular basis. It is highly contagious, and about 90% of people that are not vaccinated for it will acquire the disease. So that's the number one way to protect yourself through it.
Hi, my name is Jessica, and I'll talk to you about the signs and symptoms of measles. The initial signs and symptoms are going to be a fever, cough, runny nose, and they'll have watery eyes. A few days after infected, they'll get the cold lip spots, which are red spots in the mouth and the face, and there's these little white spots inside there, and then the body and limbs. Children are more prone to ear infections after they get the measles, which can lead to deafness, and pneumonia can also be associated with it, which is leading cause of death for the children that are diagnosed with measles. Other complications may include death and typically occur in children, not really in adults.
Like Taylor with cold.
Okay, I'm Rachel, and I'm going to talk about prevention. Really, the only way to prevent the measles is through immunization. The MMR vaccine is for measles, mumps, and rubella. You get it first when you're 12 months old. But if there's plans to travel internationally, they can make exceptions and give it earlier. And then you get your second dose when you're in the age range of 4 to 6 years old. If you're an adult and not vaccinated, you need to talk to your doctor and you can get vaccinated ASAP. And then people with measles are also put on isolation, so further contact doesn't occur.
My name's Kirsten. I'm going to talk about prognosis and treatment a little bit. The death rate is low in healthy children and adults. Obviously, the more immunosuppressed you are, the higher chance you have of getting it. But nowadays, it's not as common. Most do make a full recovery, especially today. Back in the day, I know the death rate was a lot higher. Risk for complication increases with weakened immune system, like I said. You can only get the virus once, so similar to chickenpox, like what we discussed earlier. It usually only occurs once, and then you have lifetime immunity. The virus and symptoms subside within a couple of weeks, so you go through like the rash and everything for a few days, but it can last for up to a few weeks, the symptoms of it can. And then the virus does not have a prescription at all, so there are no meds that you can take. But the doctors recommend the typical like rest, ibuprofen, or any acetaminophen, just to help with like the muscle aches that you can get and the fevers. And then they always encourage fluid intake with anytime you're sick, but they say that helps. A humidifier can help, and then any type of vitamin A supplement also, probably any vitamins, but vitamin A in particular. So, and I think that's it. All right, let's roll the tape.
You starting?
Yep.
Do some bloopers.
Okay, we can do that.
No, don't.
No, we can.
Kirsten's gonna do it
That's what
anyway.
she's gonna do.
I can cut this part out.
I was trying so hard not to laugh.
I know.
I was like, it's happening. It's over.
You're like,
Can you see my
you did
pants?
good job though.
Can you see my pants?
Nope.